Hello everybody, I want to do a quick video on something that many of you have probably experienced. Maybe you've had an x-ray in the past, could be of your spine or another body part, and it's quite likely if you were over age 20 that one of the diagnoses that the radiologist put down on the form was degenerative joint disease, or if it's in the spine, degenerative disc disease, DDD or DJD. What does this mean? Well, it depends. If this is a very mild or moderate degenerative disc disease or joint disease, it's quite likely that maybe you didn't even know that you had it. You're 20 years old, 30 years old, and this just happened to show up on the x-ray. You see, because oftentimes some of the normal things we see with aging, such as in the spine, a little bit of decreased disc height, maybe the body putting down a little bit more calcium on the edges of the vertebra, around the vertebra, to help with stabilizing as we age and as our bodies change with gravity and wear and tear. I would argue that these are in some ways good things or good adaptations that happen in a gravity-filled environment. Now, of course, as we progress and maybe we had more severe injuries or traumas to our body, you can have a severe or advanced degenerative disc disease or joint disease, in which case it's quite possible that that is a pain generator for the body, absolutely. But for many of us, myself included, I had a DDD diagnosis when I was x-rayed in chiropractic school in my 20s. Even though it was a surprise to me, I felt fantastic. I didn't know that my lower back discs had started to shrink. Fortunately, in all these 2 decades since then, I've still had good health of the lower back. But what I want to encourage all of us to do is, knowing that this happens as we age, knowing that we start to lose some disc height, that we have some changes in the spine and other joints, the real key is, what can we do to try to improve the strength, the motion, and the mobility of those joints? Because any affected joint, any arthritic joint, we know the way to help that area feel better and be healthier is to improve strength, motion, and mobility. So that's why we talk about different exercises, anti-inflammatory diet, chiropractic care. All these things are going to help restore good movement and keep good movement. And the main reason I wanted to do this video is just so that hopefully you're not afraid or fearful or pessimistic when you do see that diagnosis. And for many of us, it is not a recipe for disaster. It does not mean that we're going to be going downhill when you see that degenerative disc disease. It's just something that the radiologists have to note. They see this change on the x-ray, but in many cases, that's not even why you have pain in that area. It's present on the film, but there's other things going on in the body, in the area, that are creating the pain, which we can address. So I just hope you feel a little bit more encouraged about that. Any questions you have individually, please feel free to message or bring it up on your next visit, and have a great month.